morning. My name is Reagan. I'll be your nurse for today. Could you please verify your name and date of birth?
It is Estefanias Mario, 08/11/2002.
Okay, awesome. All right, well, I'm going to do a cardiovascular assessment on you today, if that's okay.
Yeah.
I'm going to start with asking you some questions and just answer the best of your ability. If you don't know, that's okay as well. So do you have a history of high blood pressure or...
I do not.
Okay.
No.
What about any valve diseases that you know of?
Mm-mm.
No. Any coronary artery disease or heart failure that you would know of?
Nope.
All right. What about any dysrhythmias like atrial fibrillation or
No.
tachycardia? Okay. And then any peripheral vascular disease?
No.
No. Do you know if any of your family has had any of those conditions?
I do not. No.
Okay. Do you have high cholesterol, if you know of?
I do.
Do you have
But it's genetic, yes.
Genetic? Okay. On which side?
My dad's side.
Your dad's side?
Mhm.
Okay. Awesome. Now I'm going to ask you some questions now that may not seem related, but just answer the best of your ability. How many packs of cigarettes would you say you smoke in a week?
0.
How many glasses of alcohol would you say you drink in a week?
0.
Same question for illicit drugs?
Mm-hmm.
No? Okay.
Yep.
And then could you tell me how often you exercise or what your, pattern is with that?
I try and go on walks, but being in school kind of doesn't help.
So you're a student right now?
I am, yes.
Okay, would you say that being a student has caused you stress more recently? Okay, what would you say your stress level is pretty regularly?
Oh, that's a great question. I don't want to sound dramatic by saying 10, but
It's a 10 out of 10?
It's probably a 10.
Okay. All right. Have you noticed any changes, with your heart? Do you feel like it races more often now that you're stressed?
I don't think so. I don't think it's gotten to that point, thankfully.
Okay, that's good.
Mm-hmm.
That is something that could affect your heart, your stress levels, so just be aware of that.
Yeah.
And also, what does your diet look like? What would you eat in a week?
I eat a lot of protein. I try to eat protein and veggies and fruits and stuff. And I am insulin resistant, so I try and decrease my intake of carbs than the normal person. But I definitely do incorporate that also into my,
All right, sounds good. So no excessively salty foods or fatty foods?
No.
Really? Okay, awesome. And then lastly, do you take any medications for your heart?
I do not.
So no blood pressure medicines or anti-lipidemics or
Nope.
Any anticoagulants?
Nope.
No? Okay. All right. Now I'm just going to move into my assessment. So I'm going to start with inspection. And so if you could just face me a little bit more. Sorry. All right, I'm just going to inspect her chest for any lifts or heaves. And so that's just looking at her heart and seeing if I can see it beat outside of her chest, and that would be an abnormal result. So I'm just going to lift it.
Yeah.
All right, and there's no lifts or heaves with her heartbeats that I can notice. Now I'm just going to look at her skin pretty much all over, especially in her extremities, and I would mark for any edema or different colors like cyanosis or even super red color in her extremities. So if you could just hold out your hands like this. Awesome. So her skin is an expected tone in her fingernails and in her lips and in her palms, and there's no marker of cyanosis or anything. I'm just going to look at your legs too, so I'm going to lift up your pants. All right. Same thing, it's an expected tone, no redness, and also on her legs you can see just regular hair distribution, and on her arms as well, and hair distribution would indicate oxygen status in her extremities, and also in her extremities there was no sign of edema when I inspected. I'm going to move on to palpation now, and I'm going to try to palpate her apical pulse, but sometimes it can't be felt. So I'm just gonna put my hand on her chest and see if I can feel her heartbeat. I can feel her a little bit of her apical pulse, and so just to remember with that it's, you can only palpate it in 50% of people. With that, I also felt for any lifts or heaves, and there weren't any when I put my hands on her chest to for her apical pulse. Now I'm just going to palpate her extremities for temperature and for edema. So could you hold out your hands, and then so I'm going to feel. Her skin is warm. Yep, skin is warm on her hands and feet. And I'm gonna now do her capillary refill on her fingernails. Okay, her capillary refill was less than 3 seconds, which is a normal result. And now I'm gonna have to do the same thing on your feet. So I'm gonna ask you to take your shoes off.
And your socks.
I'm sorry.
My toes look so bad, guys. Please don't look at my feet too closely. I beg.
Alright, so I'm just gonna do capillary refill on her toes now.
There's black fuzz on my feet. Why not?
Alright, awesome. On her toenails, it was less than 3 seconds as well. And I'm gonna have you, you can put your socks back on, but I'm gonna palpate your pulses in a little bit, so I'm gonna have you keep your shoes off.
Yes.
That is totally fine. And when I also was down there, I looked for edema, and there was no edema once I palpated her feet as well. Now I'm gonna move on to palpating her pulses, and I would just check to make sure that they're symmetrical in both places and that they're strong, and so I'm going to grade them as I go as well. So I'm actually going to start, I'm going to start with your radial pulses. Okay, her brachial pulses were strong and they were symmetrical on both sides, so I'd grade them a 2+. And now I'm going to go ahead and do her radial pulses. Same thing, they are strong and equal on both sides, so I'm going to give them a 2+. Now I'm going to do your femoral pulses. So yeah, you can stand up for this. And I'm just gonna go right here. Alright, equal on both sides, there are 2+. I'm gonna continue working down and now do her popliteal pulses. Alright, they are 2+ on both sides, symmetrical on both sides. Now I'm going to move on to her dorsalis pedal pulses, and these are hard to find, but I'm going to try my best. And you can also use a Doppler in the real world if you can't find them, but okay, they were there, but those were a little bit harder to palpate. So I'm going to go ahead and say that there are 2+, since they are equal on both sides. And then lastly, I'm going to do your posterior temporal pulses and grade them. Same thing, equal on both sides. 2 plus for those as well. So we have done everything for palpation, and I would also mark with her pulses that I couldn't feel any thrills with her pulses. Once I move on to auscultation, I will assess for any bruise with her pulses as well. So I'm going to go ahead and move on to auscultation. Now first, I'm just going to auscultate her carotids to hear for any bruise. So I'm going to just put my stethoscope on her neck. Awesome, there were no bruise in her carotid pulses. And now I'm going to start listening to her heart sounds, and I'm going to do them in 5 places to listen in all 5 spots, and I'm going to listen in the sitting position, laying forward position, lying position, and left lateral position for all heart sound areas. And so I'm going to start with the patient sitting up, and I'm going to listen. Here we go. And I'm going to listen with both my diaphragm and bell. Okay, for that first one, there were no murmurs, no extra sounds. I'm going to go ahead and listen with my bell. Oh, wait. Okay, there was the same results for that. There were no extra heart sounds or any bruise or murmurs present with that. So we've concluded for sitting. Now I'm going to have you lean forward a little bit. Like probably like this. 45 degrees is okay. You can put your hands. There you go.
Yeah.
Okay. And I'm going to listen with my diaphragm. Okay, I'm going to listen with my bell now. Okay, there were no murmurs or extra heart sounds when she was leaning forward. I'm going to move on to the lying position. Alright, I'm just gonna listen in the same areas and for any extra heart sounds or any murmurs with both my diaphragm and bell. I'm gonna switch to listening with my bell now. All right, there were no murmurs present or extra heart sounds present. Now I'm gonna have you switch to a left lateral position. So there you go.
1 second.
Thank you, ma'am. And I'm just gonna listen to all areas in this position as well with both my diaphragm and bell listening for extra heart sounds or murmurs.
Is my arm okay like that?
Are you comfortable?
Yes.
Yeah, okay. All right.
Oh, thanks.
All right. I'm gonna flip over to my bell now. Okay, you can go ahead and sit down. So I listened in all places, and there were no murmurs or extra heart sounds that I could listen for. All right, and now I'm just gonna do some extra tests that are kind of miscellaneous, but will also help assess your cardiovascular function. And so your first one is gonna be the Allen's test. And so what I'm gonna do is I'm gonna have you hold your hand out. And I'm going to occlude both the medial and the radial arteries. But if you could go ahead and first pump your hand like this. Okay, awesome. And I'm just going to occlude both of them. And then I'm going to let go of one, and your hand should pink up. And it does. I'll let go of the other one, and your hand turns pink again. And then for this test, a positive result is normal, and it was positive. And so our hand pinked back up once I released my fingers from one of the arteries. And lastly, we're gonna do the Hohmann's sign, which you're not really supposed to do because it could dislodge a clot. But I'm gonna have you point your leg out like this, and then point your toe, and then do a flexion. And if there was any pain, could you tell me if there was any pain? Okay. No. If there was pain, then I may be worried about a clot in her calf. But once again, you would be very careful with that test, just in case the artery or the clot would become dislodged and may cause something even worse. So yeah. But that concludes my cardiovascular assessment on you today. Do you have any other questions for me?
I do not.
Okay.
Thank you.